Welcome back to Chamber Exchange, the TV show. I want to thank our sponsors, Bank Hometown and St. Vincent Hospital, for helping make the show happen. Really happy to have with us in our final segment, Lou Brady, who's the Chief Executive Officer of Family Health Center, and also a member of the Worcester Regional Chamber of Commerce Board.
Thank you.
Lou, welcome.
I appreciate being here. Thank you for the opportunity.
Good. So, healthcare is the largest employer in central Massachusetts and in the city of Worcester. Over the course of my lifetime, at one time there were 7 acute care hospitals in the city of Worcester. Today there are 2, the UMass Memorial, UMass Memorial Medical, UMass Memorial Health Care System, and then St. Vincent Hospital. But, right behind it are our health centers in terms of volume of care to area residents and an employer. So maybe you could talk a little bit about Family Health Center.
Certainly. Well, we certainly do deliver health care to 35,000 residents in Central Mass and provide primary care, dental care, behavioral health, substance use disorder treatment. We're operating in 7 school-based health centers. We operate a WIC, a Women, Infants, and Children's, and deliver health care to the homeless. And that's
a lot.
It's a lot, and it's significant. It's modern. We just recently switched our EHR to Epic, so we are in the healthcare space.
EHR is electronic health records.
That's right.
Okay.
I will try to be mindful of my acronyms. So we do deliver healthcare. However, healthcare is just the tip of the iceberg. Health centers are more than a place for access to healthcare. It really is the modern incarnation of the civil rights movement. Mm-hmm. This is a entity that was stood up with the premise that we needed health equity, we needed social justice, and that the health centers were one way to make progress on that dream.
And this is, you mentioned in the history, 50 plus years of Family Health Center, but the movement of community health centers was started during, you mentioned this, the 1960s civil rights era was at its kind of pinnacle. There was the war on poverty, where there was recognitions that both in urban areas and in rural areas, where concentrations of white people, Indian reservations, Black, Latino, were not being served even with hospitals down the street.
Right.
So the community health center effort and legislation started at the federal level. Senator Kennedy was a champion in that, and the health centers were created.
That's right, exactly right. It's interesting. We're celebrating a couple of milestones over the last couple of days. Yesterday, Juneteenth, we were recognizing freedom for Black Americans with the entry of federal troops into Texas to let
Galveston, right?
To let folks know that they were indeed free. Today we're recognizing the 60th anniversary of Freedom Summer, where a group of activists from the North went to Mississippi to help register Black Mississippians to vote. Part of that group was a group of physicians and clinicians called the Medical Committee for Civil Rights, and then it became the Medical Committee for Human Rights. And 3 movement activists, Dr. Jack Geiger, Dr. Count Gibson, and Dr. John Hatch, came out of that with the recognition that there needed to be more than a summer of activity. As critical as that summer was, there needed to be a way to extend the effort. And so in 1964, they went to the federal government as part of the war on poverty and said, we see neighborhood health centers as an opportunity to achieve equity and justice. And they were funded with a demonstration project in the north, Columbia Point, and a demonstration project in the south, the Delta Health Center.
Columbia Point in Boston.
That's right. And we are now, years later, a network of health centers across the country, serving 1 in 11 Americans, residents, ensuring that they have access to quality health care.
And despite the times we live in where there is a lot of tension and division, this is one issue that there has been consistent bipartisan support because people recognize the need, and we do have healthcare deserts, and the community health centers have proven and demonstrated that they can make a difference in kind of curbing healthcare costs, being more proactive, cultural competencies, 77 languages that you work with.
That's right.
Yeah.
That's right. And I think the reason for this bipartisan support is folks recognize that when you have a more equitable society, when you're able to ensure that your neighbor can get the care that they need, number one, it reduces the costs for everyone. You're gonna pay, I remember the old Mining Key commercial, you can pay me now or you can pay me later.
Right.
It's a recognition that if you make smart investments, you can indeed curb the cost of care. But as COVID shows, if your neighbor is ill, that impacts you too. And so there's a need to address that. But I think the other reason the bipartisan support and the support of business leaders and others across society is it's a economic engine. We generate jobs, we generate direct economic benefit to the communities that we serve by purchasing services. So we are good neighbors.
And just specifically, how many people do work for the Family Health Center?
At our particular health center right now, we're at 425 employees. And then there's the ripple effect of the purchasing that we do that supports others, outside of our walls.
Right. And the primary location in Worcester off of Chandler Street, but also you do some outreach beyond that.
That's right. So we're at the old Worcester City Hospital,
City,
26 Queen Street.
Queen Street in Chandler, yeah.
But we, are sprinkled in the schools. We have another site on Chandler Street for Worcester Healthcare for the Homeless, and then we're downtown in the Unum building for WIC.
Right.
Yeah.
And one of the things that Family Health Center does also has an affiliation with UMass Medical School.
That's right.
And
so we
UMass Chan Medical School.
That's right. So we're actually celebrating a 50th anniversary of that marriage. So the Family Health Center and Social Services started in 1972 as our local effort on the war on poverty. And it was built in the feedback from residents from Maine South who said, what we really want is a family doctor, somebody that understands us, that is caring for us, that cares for the entire family. I don't need to repeat my story again and again and have things dropped in the breach. And 2 years later, in 1974, the UMass Medical School recognized that they needed a place to train their family medicine docs. How do you train the next generation of providers? You put them in an environment where they can make a difference and where they can truly learn the breadth of the care. So, so we celebrate our relationship with the medical school and continue to expand upon that relationship, and we see it as mutually beneficial.
Great, great. So Lou, we're just about out of time, but if people want to learn more about the services that Family Health Center provides, employment opportunities, where can they go?
Absolutely. So they can go to our website, fhcw.org. And if people are looking to support this cause of a more just and equitable society, they can go to fhcw.org/donate.
Great, great. Well, Lou, thanks for being with us and sharing about the important work, both in terms of providing health care, but being an economic catalyst as well.
Thank you, Tim.
Good.
Appreciate you.
And thank you for being with us on this edition of Chamber Exchange, the TV show, and our sponsors, Bank Hometown and St. Vincent Hospital.